Dr. Staker, again coming to you with an educational video during our COVID epidemic. We're grateful for your attention and the opportunity that we have to share some of the things that we're learning during this process with you. We're here to talk to you today specifically about social distancing. That's the word that everyone hears that we're talking about, and we would like to address some of the do's and don'ts when you're trying to social distance. You can look at the link following this video for some specifics. We've created a visual way for you to look at that and look at some different recommendations. Basically, it boils down to when you're trying to social distance, most of the things that you're not supposed to do have been luckily eliminated for you. Schools are closed. Many of our businesses are closed. Many of the places that we would go to be around other people are not available right now because we're strongly encouraged by our governor and by our president to social distance. So things that would put you in proximity to someone else, a good rule of thumb is a 6-foot measurement. If you're going to be closer than 6 feet, then you're not socially distanced. Things that you need to be careful of would be places where you might come into that kind of contact, going to the store, going out and about to a playground where you might be around other people, or to a park. If you're coming in contact with people, if you're closer than 6 feet, make that distance separate out. Anytime you've been closer than that, you need to go through what we call proper hygiene, washing your hands specifically, not touching your face, doing things to avoid the spread of germs. And then things that are okay. It's good for you to go out and walk and be outside. Just be by yourself and go out and do things that don't put you in the proximity of others, but to let you to enjoy. Social distancing is hard, mentally a tough place. It's hard for us not to be around other people, especially the people that we love at this time. But making that sacrifice decreases the risk of spread of the disease and minimizes our chance of increasing infection in our population. Let's talk about the difference between social distancing, quarantine, and isolation. These are words that are being thrown around a lot these days, and it's important for you to understand what the difference is and how that should affect your activity. So we'll start with social distancing. The simple recommendations are more than 6 feet away from other people, no groups larger than 10, and keeping a safe distance, avoiding contact, avoiding direct contact with your own face, not touching your face, not touching your eyes, and avoiding any coughing or sneezing in public, anything that would pass those kinds of germs. This is the kind of thing that you should practice, that everyone should be practicing right now at these health recommendations to limit the spread of disease. As the risk gets higher, the isolation or the recommendations change and we move to a quarantine. Quarantine sounds like a big scary word, but quarantine is what we do for people who have potentially been exposed to a disease but don't yet show the symptoms. So this is what's being recommended for anyone who may have been exposed to COVID but yet is not currently experiencing symptoms. A quarantine means it's more strict than social distancing. So this is a stay-at-home situation. You're not to be around other people. You're not to gather even with close family contacts. Still the 6-foot limit applies, but it's even tighter than that. They don't want you to be around other people in any kind of a setting. They don't want you to share utensils or cups or anything along those lines. And although you can be in the same house with someone being quarantined, you can't be in the same room with them. You can't share the same living space. You need to be physically isolated from those people. And the final is isolation. This is what we do for people who are showing symptoms of a disease. So someone who's infected with COVID actively, if they're socially isolated, this is the most strict recommendation. Isolation is no one else is in that room. They don't share food. Their food is delivered to them. Everything that they need is delivered to them. They don't leave their living quarters for the time of their social isolation. In conclusion, we want to remind you that all of these levels of isolation, social distancing, quarantine, and isolation, all require the basic control measures. You don't touch your face, don't touch your eyes. You wash your hands for 20 seconds. That's a long time. There's all kinds of internet things to sing a song or play something while you're doing it, but you wash your hands with soap and water for 20 seconds, or use an alternative hand cleanser for the same amount of time, and allowing that to dry on your hands to completely sanitize them. We don't gather in groups. We don't touch other people. All the things that we like to do in the basin, give hugs and shake hands, get to wait for a while. Right now, we bump elbows at the most and don't touch each other, stay away and keep that social distance to protect ourselves and those that we love.